Good day and welcome back to Help Me With My Teeth.com. Today we're going to move into a requested tooth talk for Mrs.1202. Here at Help Me With My Teeth.com, we leave the choice to you whether you would prefer to keep your tooth talk private, in which case it would be sent directly to you and only to you, or if you would be willing to allow it to be used for educational purposes, at which time we would shield your confidential information with just a simple code for your name, such as Mrs.1202. So let's move right into the images that she sent in. Mrs.1202 sent us two images. We have an intraoral can image that we're looking at right here, and then later on we're going to get into the radiograph, the periapical radiograph. Just to touch briefly on the image quality here, we generally are quite happy with these images. Mrs.1202 got nice isolation here, a nice dry tooth. The resolution and the focusing maybe is not perfect, but generally this is quite nice quality. So let's get going and talk about these images. Alright, so let's get a little orientated in terms of this image for Mrs.1202. So we're looking at an image of the lower right quadrant. So down here we got the second bicuspid, then we have the first permanent molar, and then the second permanent molar up here. Over here we have the tongue, and then over here's the cheek, just to get all kind of orientated and set up. So a couple of things that jump out at us right away. One is the second bicuspid is generally all natural tooth structure. Down here we're not seeing any filling or crown or any sort of restorations or fractures or anything like that. So the first permanent molar, we have a large amalgam restoration here. So this is a silver amalgam, maybe a little bit of an old-fashioned filling. Probably what are we going to say, 2/3 to 3/4 of the coronal structure is restoration. This is kind of the issue at hand. We've got a little fracture here that's happened on the buccal surface or the cheek surface in between the two molars. Back here you'll notice just the translucency of the tooth looks maybe a little different. This is actually porcelain. This is part of a crown all back here. We've only got half of the tooth, and here's a little bit of erosion of the porcelain that's showing the underlying metal coping of the crown. This is a porcelain fused to metal crown. I don't want to kind of bore you with all the technical details here, but this tooth probably underneath the crown has a filling very similar to this underneath there. I'm guessing, I don't know that for sure, but I think that's a pretty good guess here. Just one other thing that kind of jumps out in this picture is down here. You'll notice we have a couple of bony kind of marbles down here. These are called mandibular tori. Just totally natural, nothing wrong with these, nothing scary. We tend to see these in folks that grind their teeth at night or have nocturnal bruxism. This is something that tends to play out in that situation. The clenching of the jaws at night tends to just stimulate just benign growth of bone, and that's what we're seeing here. It's just a bony growth with gum tissue over the top. So maybe a little bit of a hint of some grinding at night, which would definitely play in with the fracture that we have and the erosion of the porcelain up here on the crown. So that's just something to keep in mind and discuss further, as if perhaps there's a nighttime grinding issue, or even perhaps a daytime grinding issue. Okay, so let's get into really the tooth at hand here, which is our first permanent molar. That's really the kind of the center point of the discussion here, and we have a fracture on the distal buccal aspect of that tooth. So that's the cheek side, sort of backmost aspect of the tooth. Looking at this a little more in a little bit more detail, we can see that if we look down to the floor of this fracture, down in this area, you can see that it looks like natural tooth down there. You know, we're not seeing filling like here, down here. If it looks silver or it looked like a restoration down here, that would lead us to the idea that perhaps the filling itself had fractured, that a piece of filling came out. But in this case, my greater suspicion is this was actually an enamel fracture, that the enamel actually fractured right here, and this was tooth structure. Most of the time we don't get to see the piece that comes out. Most of the time it happens in a restaurant or something, and the little chunk just goes right down the hatch. If you can find it and just put it in a little Ziploc bag and bring it to the dentist, it is helpful to see what actually fractured here. Not a huge surprise that this tooth fractured. I mean, look at the size of this filling. We're talking, you know, quite a weakened tooth. My other suspicion, and this is just a hunch, I have really no facts to back this up, is that this cusp fractured here at an earlier date, and that this filling was placed to actually repair that fracture. I have a bit of a hunch that this Mrs.1202 has had sort of regular fractures of her coronal structure. Getting back to the tooth grinding that we were talking about earlier, generally grinders tend to have these fractures. So the big concern with this tooth is, are we going to get a further fracture? What we really don't want to see is this cusp breaking off, or the entire wall on the cheek side, we call the buccal wall. We don't want to see that all cracking away, because if that was the case, there'd be not much tooth left to this, and then this tooth is getting in a very precarious situation where we might have to even consider extracting it, removing it, and putting some sort of prosthetic tooth in, or, you know, kind of a fake tooth to replace it. As it sits right now, I think this tooth is generally still quite usable and has a lot of hope for restoration. We're going to get into that a little bit later as to exactly the options. But when you have a filling of this size sitting in here, we see the hints of the grinding here. This tooth is substantially weakened, and what we don't want to see, what we want to do is really protect this tooth from further fracturing. So let's get into this radiograph or digital x-ray a little bit more. This gives us a whole different dimension of looking at this teeth. Just to familiarize ourselves where we're at, here's our second bicuspid, so that's the little tooth right in front of the molar. Here's our first permanent molar. This is our tooth that had the little chip in it, the little crack. And here's our second permanent molar, or our crown tooth that had the little wear in it, if you remember back to our other image. Getting into this crown tooth, there's a pin kind of poking through underneath here. So underneath this crown, there's a pin that goes through here. Generally, just kind of substantiating my hunch that I think underneath this crown, we got quite a large filling in here. My hunch is that this tooth had a number of fractures on it previously. Kind of went the same way as our tooth in question did, one we're talking about today. Thankfully, our second bicuspid is like a brand new tooth. Really no fillings in that, no trouble at all. That tooth looks pretty much brand new, so that's good news. The big thing we're looking for here is any evidence of a fracture inside this tooth. We could have got a horizontal fracture through here, or we could get a vertical fracture through here. They're generally hard to pick up on an x-ray, but what we do tend to see are troubles that come as a spin-off to the fracture. We get into a vertical fracture here, generally the furcation bone, so the bone in between the two roots, tends to deteriorate. We see sort of a big black cloud in here, which we're not seeing here, which is great. The other thing we're really wouldn't be happy to see is some trouble down here at the apices of the teeth, or the apex, which is the end of the root. If we get a damaged nerve from this fracture, then this nerve tissue that runs down here ends up getting into the bone and the ligament at the bottom, and we end up seeing trouble at the end, and that's generally not what we want to see if we're going to get into starting to repair the coronal aspect of this and starting to, you know, put fillings and crowns and spending money on the top, and then we find out there's trouble below. When you build a house, you want to build your house on a good basement. So not seeing any of that here. Everything looks peachy down here. Not seeing any trouble in the bone at the apices. No fractures. Furcation looks good. I'd say this is a green light. We're good to go. Let's put this tooth back together. Okay, so let's put all the pieces together here and talk about where we go with this tooth. Generally, this is a fairly straight ahead situation. We don't really have any doom and gloom scenarios here, so lots of hope here for putting this tooth back together. Door number one here would be just to do a very small repair in the fractured area. It's a big temptation to just leave the filling in there and just repair the little fractured area of the tooth with a small restoration, a small filling. Would certainly keep the price down, would be super fast. I've done tons of these without even freezing folks, so you know that keeps things nice if you can just stay away from the anesthesia. The bad news of that is that we're probably not going to get a lot out of that. It's kind of a band-aid repair, and it's likely going to refracture, or worse, we're going to get more loss of coronal tooth structure. So probably not the best idea, but that's definitely door number one. Door number two would be removing the entire filling and then replacing that with a white bonded composite filling. Maybe moving away from the amalgam. Generally don't do a whole lot of those anymore, and get into a white bonded composite. You can always search through YouTube if you want to see more info about that. But that would actually bond to the remaining tooth structure, which is always nice, and we can incorporate the fracture right into the new filling. So the filling would be a one-piece situation, which is better than door number one, which would require bonding to the existing filling, which is kind of tricky to do. So that would be definitely a decent option. I think that could last for years. The real downside of that is, again, we still have exposed natural tooth structure, which we can't afford to lose anymore here, or we're really going to put this tooth in peril and could see it end up being lost. Which leads us to our third option, which is to consider getting into a coronal restoration, or better known as a crown, or some people even call it a cap, which is quite a different way to restore a tooth if you've never been through that process. It's a little longer, significantly more expensive. That would probably get up around $1,000 to get a crown done, depending on which area of the world you live in. But probably the strongest way to give this tooth a lot of hope for the future, because we would protect the entire tooth, surround the tooth with the zirconia, which is the new type of crown, which is a step up from the other crown that you saw in that Intraoral Can Image, and would probably give this tooth the best shot of really going the distance and lasting. And I have to say, this is really where I would tip my hat here. I would really recommend a crown here. If it was my tooth, that's what I would do. And I think if we really want to keep this tooth going, that's really the best option. Our x-ray was all clear there, nice green light, no impending trouble there. So I think we generally have pretty straight, smooth sailing there to get a crown on that tooth. Last and probably least is some would maybe throw in the idea of, let's just get rid of this tooth. The filling's too big. Why put any more money into it? Let's just take it out and put a prosthetic tooth in, or a fake tooth, in terms of a fixed bridge or an implant or something like that. This seems a little heavy-handed to me. I don't think this tooth has really gone that far down the drain in order to think about getting rid of it. But just for the sake of completion, we'll include that, and you can sniff around YouTube a little bit more and find out the ins and outs of the different prosthetic options for tooth replacement. So that kind of wraps it up for Mrs.1202. There's your four options: the small filling, the large bonded composite, the crown restoration, or number four, the extraction with the prosthetic replacement. So I hope that gives you an idea of what ToothTalk would look like from helpmewithmyteeth.com. You can see that it's a comprehensive online dental consultation that gives you all the ins and outs of your particular dental problem that's personalized just for you. Hope that filled in the blanks for you, and we'll see you next time at helpmewithmyteeth.com. Have a good one.